Hello and welcome to our Retirement and Wealth Strategies webinar series. Today we'll be focusing on Medicare. Our presentation is from one of our independent Medicare partners, Kevin Cox of Medicare Reimagined. I'll be your host and moderator for the day. I am Nicholas Scarcella, Vice President of RWS. As you could see, we're a little excited to get started with the back and forth slides there. So we're happy to be here. And we want to start with a little presentation or a few slides about RWS. Then we'll hand over the presentation to Kevin for the bulk of the content. So let's start with a brief introduction. Retirement and Wealth Strategies, we are a fiercely independent wealth management firm established in 1985 with over 35 years of experience. We have 17 office locations in the Great Lakes region with our home office in Farmington Hills, Michigan. As a company, we have 32 financial advisors and we serve over 7,000 families across the country. So our core values, these are our commitments to you as our clients, and they are education, trust, relationship, compassion, and competency. So first, education, what we're doing here today, providing information to our clients and to the communities we serve. Trust is the cornerstone of what we do. We earn your trust, never abuse it, and always have your best interest first. Relationship, we pride ourselves on the friendships we develop with our clients, and in many cases, we work with multiple generations. Compassion is our patience and understanding to your evolving needs and circumstances. And finally, our competency to be credentialed and knowledgeable in all areas important to you. Little housekeeping, and we'll hand it over to Kevin. Here, everyone's camera is off, microphones are muted. This is a webinar Zoom format. So if you're eating dinner, enjoy. If you're yelling at your dog, we can't hear you. Q&A, we will have active Q&A throughout the presentation. On the next slide, we'll have the phone number you need to text. The webinar is being recorded, so if you want to watch this again or share it with someone you think would value it, it'll be on our YouTube channel. Finally, at the end, there's a brief survey. We want to hear from you so we can keep improving these webinars and make the most impactful to you all. The presentation today is going to be roughly 60 minutes, again, with questions and answers throughout. Here's the text message due to compliance. Since the Q&A and webinar is not archived, we do need to have our company phone number is where you can text us any questions. That is 833-797-4636. Please text us questions throughout. We'll answer those as they come up. Anything we do not get to, we will email or text you back later. With that, I'd like to welcome Kevin Cox, our presenter, independent Medicare advisor of Medicare Reimagined. Thank you, Kevin.
Thank you, Nico. Can everybody hear me okay? Nico, can you hear me?
Yes.
Awesome.
And Kevin, we could start off with a little bit about yourself, your company, and also what it means to be an independent Medicare advisor.
Absolutely. Thank you so much. So a little bit about myself is that I am a local Medicare resource or a Medicare agent. What I do is I help folks transition into Medicare and facilitate the enrollment and provide guidance with this decision that you're going to make about the future of your healthcare. I have been in the Medicare space for just over 10 years. Prior to being a Medicare agent or broker, I worked directly for the health insurance carriers locally here in our state. So I worked for Blue Cross Blue Shield of Michigan. I worked for Priority Health, which is based out of West Michigan or Grand Rapids, and I worked for Health Alliance Plan. Within that tenure, I worked locally with insurance agents and I helped educate folks on how to effectively communicate information that is needed to make an educated decision about the future of your healthcare. With working with an independent agent or broker, our services are free to you. We do not charge you to be able to work with us. So just know that we are here as a local resource to provide you the information that you need and the education you need to make an educated decision about Medicare.
Perfect. Thank you, Kevin. And Just before we get into the content, I know you recently rebranded to Medicare Reimagined, so we'd love to hear what that means to you and to the clients you serve.
Absolutely. So really our philosophy is to be a local resource for you. Medicare, as you are going to see over this presentation, is very, very confusing and complex. It changes every single year. Here in the state of Michigan, you have 10,000 people a month who are becoming eligible for Medicare, and that is due to the baby boomers. So why we pride ourselves on being a local resource and rebranding as Medicare Reimagined is that we are here for you. Things change, your needs change, you have questions, you always will have a resource to come to as those things come up.
Thanks for that. I love it. It is ever evolving. I was just speaking to someone earlier where sometimes too much, many folks covered by health insurance feel like too much onus is on them to figure out even to get referrals or find a doctor or what prescriptions are covered. And that's, again, what you're there for in many cases, right?
That is correct. Absolutely.
Great. So this is where I turn off my camera and the floor is yours, Kevin. Thank you again.
Awesome. Thank you so much. All right. Thank you so much, Nico, for inviting me today to be able to provide you this information. The intent of this presentation is really to give folks the information that they need to make an educated decision about the future of your healthcare. If there's folks here on this presentation that are getting ready or getting close to retirement or getting close to turning 65, you are going to find that there's a lot of information here that is going to be very, very helpful to help you make that educated decision about the future of your healthcare. It is extremely common for folks to ask relatives or friends or coworkers, I'm turning 65, what did you do or what do I need to know about this transition? What you have to understand is that you are doing the right thing by jumping onto this webinar and getting the information you need. Medicare is very confusing and complex, and it is not a one-size-fits-all. You are going to see, as you transition into this program, you are going to have options and you are going to have decisions to make, and that is what we are going to break down for you. So what we're going to go over today is strictly educational. What we're going to talk about is what is Medicare. We're going to talk about who is eligible for the program. We're going to talk about enrolling into Medicare Part A and B and mistakes that you may want to avoid. And then we're going to talk about the additional benefits that you are eligible for, what's known as Medigap or Medicare Supplement. And then we're going to talk about Part D, and then we are also going to talk about Part C. And as Nico mentioned, the presentation itself should take about an hour. We encourage your questions and we will answer them along the way. So let's get started. So what is Medicare? Medicare is a federal health insurance program that is administered by the Centers for Medicare and Medicaid. This is the largest health insurance program in our country. It's currently covering about 46 million Americans. And as I mentioned a few minutes ago, it is growing and it is growing very, very quickly. There are about 10,000 people a month alone that are becoming eligible for the Medicare program. Some folks tend to get Medicare confused with Medicaid. And just remember that Medicaid is the state-funded health insurance program for those with low income and low assets. And Medicare is the federally funded health insurance program. So who is eligible for Medicare? Most folks, your initial eligibility is going to be when you turn 65 years old, but just know that there are folks that can qualify for this program who have certain disabilities or maybe certain chronic conditions. But for the majority of people, your initial eligibility into this program is going to be turning 65 years old. So what we're going to go over here at the very beginning is what we call traditional Medicare or original Medicare. So when you go to apply for Medicare benefits through the Social Security Administration, the parts of Medicare that you are going to be qualifying for, applying for, is what's known as Part A as in apple and B as in boy. So what is Part A? Part A is hospitalization. Now, when we talk about hospitalization, we are not talking about going to the hospital, having an MRI and leaving the same day. We are talking about inpatient admission. Any time that you are admitted into the hospital and you are on Medicare, that is going to get billed under Medicare Part A. As far as eligibility, it is going to be dependent upon your age, your citizenship status, as well as for certain folks, it may qualify you based on disability and certain chronic conditions like end-stage renal disease. As far as the cost for Medicare Part A, most folks, not all, will qualify for Medicare Part A premium free. How do you know if you are going to be an individual that's going to qualify for this part of Medicare at no cost? This is going to be dependent upon your work history or your spouse's work history. So if you or your spouse has paid into Social Security for greater than 10 years or 40 plus credits, your premium for Medicare Part A is going to be zero. As you can see on this slide, individuals that maybe do not have a very long work history may still qualify for Medicare Part A, but they may have a monthly premium. When you go to apply through the Social Security Administration, they are going to do their assessment based on your application, and they will let you know whether or not you have a monthly premium for Part A. But if you or your spouse, because you can use their credits as well, has paid into the Medicare Trust Fund or Social Security for greater than 10 years, you will qualify for Medicare Part A at a $0 premium. Some additional benefits are also covered under Medicare Part A, but the main one is inpatient admission. You will also have things covered such as skilled nursing, hospice care, blood transfusions, and some forms of home health care are covered under Medicare Part A. So we talked about eligibility. We talked about what the monthly cost is going to be for Medicare Part A. How about if you need to go in and use your insurance once you're enrolled at the hospital? What is it going to cost you when you show your card? So the information that I'm sharing with you here is not to alarm you, it's to educate you and help you understand why you may need additional benefits once you transition to Medicare. Because if you enroll into Medicare Parts A and B, and you do not pick up anything else, this right here will be your reality. So if you get admitted into the hospital, whether it's 1 day, 2 days, 3 days, 4 days, you will have a $1,600 deductible per admission. That is not annual once a year. So if you are discharged and you've been out for greater than 63 days and you have to go back in, you will pay $1,600 again. So you may have to pay this deductible multiple times throughout your calendar year. As you can see on this slide, if you were to have a very, very long admission, going days 61 and beyond, you start to have a flat dollar copay. Now, keep in mind, as we go through this presentation, I'm going to help you understand how you can either minimize some of this cost or reduce it altogether. But when you go to enroll into Medicare Part A and you do not have any additional benefits and you get admitted into the hospital, this is what your out-of-pocket costs would be. The Medicare program changes every year, and this is one of the parts that changes. So last year, the deductible was $1,585. So as you can imagine, the federal government makes assessments to the program, and historically, these numbers go up year over year. So moving forward to Medicare Part B. This is the second part of Medicare that you will qualify for or enroll into when you go through the Social Security Administration to apply for your Medicare benefits. Medicare Part B is your medical benefit. That is your outpatient, right? So think of anything that is done outpatient will get billed under Part B. You're talking about doctor visits, blood work, x-rays, MRIs, physical therapy, durable medical equipment. You get the drift. Anything that is going to be billed that is not coming under an inpatient admission is going to get billed under Medicare Part B. Folks will qualify for this part of the program based on your work history, your age. Some folks may qualify based on their disability status or chronic conditions. Different from Medicare Part A, there is a cost for Medicare Part B. The standard premium for Medicare Part B for 2023 is $164.90 a month. What you have to understand about the premium is that it is income adjusted. Higher earners or higher net worth individuals will pay a higher amount for their Medicare Part B premium. And this is where I work very closely with RWS because I am not a financial advisor, I'm a Medicare advisor. And I always tell my clients, if you do not have a financial advisor, it is very important to get one because how you claim your income can have an impact on your Medicare Part B premium. So how do you know if you are going to be paying more for your Part B premium? There is what is known as what's called the IRMA, Income Related Monthly Adjustment Amount. This is where the Social Security Administration takes into consideration your earnings to determine what you're going to pay for Part B. What you have to understand is that this is always a moving target. If there's anybody here on this webinar that is going to be applying for Medicare this year in 2023, when you go to apply, Social Security is going to be pulling your 2021 federal income tax return to determine what you are going to pay for your Part B premium this year. If you are a single individual filing an individual federal income tax return and your income was below $97,000, you will pay $164.90 a month for your Part B premium. For all of those that are on here that are married and file a joint federal income tax return, if you are below $194,000 in 2021, you will see that you will have a premium of $164.90 a month per person. As you see on this chart, higher earners can pay more money. So the highest amount that someone can pay for their Part B premium is $560.50 a month. So what you need to know is that once you apply and you are assessed your Part B premium, that is not locked in. Going into 2024, 2025, this gets reassessed every single year. So when you have a very good financial advisor, they're going to try to keep you below these thresholds so that way you do not have an inflated Medicare premium. We have to understand that things happen in life, right? You could inherit money from a relative that passes away. You could sell a piece of property. You could win the lottery. If you report a higher earnings on your federal income tax return 2-3 years down the road, it is going to have an impact on your Medicare Part B premium, okay? Some of you on this webinar may be getting ready for retirement. You may say to yourself, well, I make that type of income now, but I will not be making that income in retirement. That is okay. If you are losing income due to loss of your job, you will be able to file an appeal to have Social Security reduce your Part B premium sooner rather than later. That's where we will come in. We will ask the right questions. We will help you file this appeal so that way you are not paying a higher Part B premium when you do not have to be doing that. So as you can see, there is a cost for Medicare Part B. Some individuals that I run into say, well, I'm not going to pick up Medicare Part B because I'm not sick. I don't have chronic conditions. I never go to the doctor. As my healthcare needs change, I'm going to pick it up later. You have the right to do that. But if you do not pick up Medicare Part B when you are first eligible for Medicare at 65 and do not have other credible coverage in place, when you go to enroll into Part B later, you will have a monthly penalty, which is lifetime and will never go away. What does that penalty look like? How Social Security assesses the Part B penalty is based on the Part B premium. So what they will do is for every 12 months that you go without Medicare Part B, when you should have had it and did not have other credible health insurance in place, it is a 10% penalty. So this chart is to give you an example. Someone went 12 months without Medicare Part B, and they went to pick it up the next year. they will pay $164.90 plus an additional $16.49 a month for their Part B premium. As I mentioned, this penalty is monthly and it is lifetime. It will never go away. So it is very important to make sure that you are making the right decision in a timely fashion so that this does not become a reality for you. So we talked about eligibility. We talked about what it's going to cost you to get enrolled into Medicare Part B. How about when you need to go in and use it and show it at the doctor's office or the physical therapy office or the lab? What you have to understand is that you will have a deductible of $226. So what that means to you is that that is an annual deductible. Before Medicare kicks in and covers any part of your outpatient medical benefits, you have to pay the first $226. Once you satisfy that, Social Security or Medicare will come in and start to cover you at 80%. You will pay 20% for all of your Part B claims. So every time you show your red, white, and blue Medicare card, you are going to get a bill for 20% of the cost. The most important thing that you need to take away from this slide is that Medicare Part B does not have an out-of-pocket maximum. So think of the health insurance plan that you may be on right now through your employer, or maybe through the Affordable Care Act, through the marketplace. If you ever reach your out-of-pocket maximum or a threshold, you stop paying healthcare costs and the insurance company kicks in and covers you at 100%. Medicare does not work that way. You will always pay 20% for your out-of-pocket expenses underneath Medicare Part B with no stop. Additional benefit. Yes, sorry.
If I can interrupt for one question, do you have to register for Part A the year you turn 65 if you are still working?
That is an excellent question. And I always tell folks, and I will say this until I'm black and blue in the face, what you have to understand, and that to answer that question is it's going to be dependent upon the size of the employer that you are with. If you are with an employer that is greater than 20 full-time employees, the answer to that question is no. If you are with an employer with greater than 20 full-time employees, Medicare classifies you as large group. And no, you do not need to pick up any part of Medicare when you first turn 65. If you are with an employer that is less than 20 full-time employees, that is a very slippery slope, and you will want to enroll into Medicare Parts A and B, and I will talk about that here in just a few minutes. So the answer to that question is going to be dependent upon the size of the employer that you work for.
Thank you.
Yep. So additional benefits that are going to be covered under Medicare Part B is going to be things like doctor visits, outpatient medical services, home health care, durable medical equipment, preventative services. So the way you got to break this down is that what am I going in for? Am I being admitted or is it being done in outpatient? If it's through admission, it gets billed under A. If it's outpatient, it gets billed under Part B. So what we just went over is what is covered when you go to apply for Medicare through the Social Security Administration. You can see there is cost, and you also see there are things that are not covered or that we did not discuss that Medicare doesn't cover. So some common things that people may think Medicare covers or may want Medicare to cover, they do not. And what are those? One, prescription drugs. So I want to take a pause here and talk about prescriptions. The only type of prescriptions that are going to be covered under what we just went over are prescriptions that are going to be provided to you through a hospital admission or prescriptions that are provided to you in an outpatient setting like chemotherapy or injections at a doctor's office. Those are covered under Medicare. What is not covered under Medicare are prescriptions that you may pick up at a retail pharmacy or medications that may come to you through the mail order program. Other things that aren't covered would be dental And so when we talk about dental, you may start to read articles that say, oh, Medicare is starting to cover dental. I will be very transparent and explain to you what Medicare will cover when it comes to dental. Let's say, unfortunately, you become diagnosed with cancer and you have to go underneath or go through chemo, and your provider says, we won't start the chemo treatment until you get rid of the infected tooth. Medicare will cover for the extraction of that tooth to get rid of the infection so you can go forward with your medical treatment. Medicare is not going to cover your annual cleanings, your bridges, your crowns. That is not covered under the red, white, and blue Medicare card. When we talk about vision, saying it's not covered, we are talking about your routine eye exam or your lenses and contacts and frames. What Medicare will cover will be things like cataracts, glaucoma, diabetic eye exams. Medically necessary vision services will be covered under what we just discussed. And then other things that aren't covered that some people may want or need would be things like hearing aids or over-the-counter benefits. So what I want you to understand is that if you are turning 65 here in the future and you want to enroll into Medicare on your 65th birthday, you have to understand that some folks have to take a step. It is not automatic. How do you know if you are automatically going to be enrolled into Medicare or you have to apply yourself? If anyone on this webinar is going to be collecting Social Security prior to turning 65, you will automatically be enrolled into Medicare. Your red, white, and blue Medicare card is going to show up in your mailbox about 3 months prior to the month you turn 65. If you are not collecting Social Security prior to turning 65, you have to take a step. You have to initiate your enrollment and you have to submit an application. Social Security or Medicare is not going to call you and say, hi, Mrs. Smith, we see you're turning 65 in 4 months. Do you have a few minutes to complete your enrollment? No, it is your responsibility to take action and do it in a timely fashion so you are not penalized or miss any enrollment periods. If you want Medicare to start when you first turn 65, you will get what's called an initial enrollment period. This only happens once in your lifetime. Once it's gone, and it never comes back. What is the initial enrollment period? It is a 7-month window. It is 3 months before the month you turn 65. It is the month of, and it is 3 months after. If there's anybody here on this webinar that has a birthday that falls on the first of a month, so June 1st, July 1st, your Medicare eligibility is actually the month prior to the month you turn 65. So if your birthday is July 1st, your Medicare eligibility starts on June 1st. So that means you have the 3 months before the month of June, the month of June, and 3 months after. As long as you apply for Medicare during this period, you will be enrolled and you will not face any late enrollment penalties. Once this window closes, it does not come back. So after it's closed, when are your next opportunities to pick up Medicare if you did not pick it up when you first turned 65? You have what's called the general enrollment period. You do not want to be somebody who is applying during this window. Anyone that's applying during the general enrollment period will get their application processed by Social Security, but you will face a late enrollment penalty. This period runs between January 1st through March 31st of every single year, where anybody who did not pick up Medicare when they were supposed to do so can now pick it up. Social Security will process your enrollment, but you will be assessed a late enrollment penalty monthly for the rest of your life. And then the third period would be what's called special enrollment periods. So we had a question from Nico, or one of the individuals here in the audience, that says, do I need to pick up Medicare if I'm working past the age of 65 and have group health insurance? And I told you it depends on the group size. And for those that are part of a large group, the answer was no. So if you get ready to retire and it's the middle of the year, when is your opportunity to pick up Medicare? If you lose creditable group health insurance you will have an 8-month window from the loss of your group health insurance to apply for Medicare. As long as you apply at any point within those 8 months, you will not face any late enrollment penalties. If you are applying for Medicare outside of that initial enrollment period when you first turn 65, it becomes a manual process. There is additional paperwork that you have to submit in order for Social Security to turn your Part B on at a later date with no late enrollment penalties. In a few minutes here, I'm going to go over that process, but I want you to understand that if you have a qualifying event, you can get Medicare at a later date and you may not or will not be penalized. There are two things that I like to talk about here through the Medicare secondary payer. What you have to understand, and you may read articles where they say that the Medicare trust fund is depleting and it may not be here in 10 years or 5 years or 15 years. The federal government has an obligation to protect this money that is in this account. And typically, not always, Medicare is going to be the payer of last resort, meaning if there's another party that is financially responsible, they will pay after that party to protect those funds. I am not going to go over every scenario here in this section, but there's two things that I always talk to my clients about here. One is group sponsored health insurance, and two is auto insurance, okay? Now, I am not a property and casualty agent. I focus on Medicare, but I get questions all the time from my clients regarding auto insurance. They'll call me and they'll say, my P&C agent called me and told me that they're going to be able to lower my auto insurance rates because I'm turning 65. For any of you that are here on this webinar and get that phone call, there are some things that you need to consider before you make this decision. A few years ago, there was reform to the auto insurance or to the PIP, personal injury protection, here in the state of Michigan. One of the things that changed was anybody who was enrolled into Medicare, A and B, has the right to opt out of PIP. When you make that decision, essentially what you are doing is you are reversing the coordination of benefits. You are now saying Medicare is going to be primary in an auto-related accident, and my auto insurance is going to be secondary. And of course, naturally, by doing that, the insurance company for your auto is going to be able to reduce your rates because they are not financially responsible at 100% for your auto claims. When you do that, you have to understand that you are giving up benefits. And let me explain to you what I mean by that. If you become permanently disabled due to an auto-related accident, and you need to have one of those chair lifts that lifts you up the stairs inside your home, or one of those ramps that gets stalled on the exterior of your home that gets you through your front door, that PIP policy would have covered that you opted out of. Medicare will not cover that. There are certain behavioral treatments that PIP covers that Medicare doesn't. So what you need to understand when you get a phone call from your agent or a letter that lets you know they can lower your rates because you're turning 65, you need to take a step back and look at what you are giving up if you choose to do that. The other thing you have to understand as well is that Medicare is the payer of last resort. And if you choose to do that, and there is a financial settlement due to a lawsuit due to the auto accident, and Medicare paid anything out on your claims, they are going to come for their money out of that lawsuit, and then the rest will be divided up between you and your attorney. All right. So I'm not saying that you don't want, or that you did that not, I'm not saying not to opt out of PIP, because you have the right to reduce the amount from unlimited to certain dollar amounts. But all I want you to know is just to take a step back, assess your situation, and see if the savings is financially worth it. Okay. The second part that I like to talk about here is group health insurance. So for those of you here that are on this webinar that are going to be working past the age 65, and we've already had the question, and this is always the number one question when I do these seminars, is do I need to do anything if I'm going to continue to work or I have coverage through my spouse's employer and I'm turning 65. The first question you have to ask yourself is the coverage that is being offered to me being provided by an employer with more than 20 full-time employees or less? If it is an employer that is more than 20 full-time employees, the answer to that question is no. You do not need to do anything at this time, and you can continue with the group health insurance and pick up Medicare at a later date, and you will not be penalized. If it's less than 20 full-time employees, it gets very tricky. And what do I mean by that? When it's less than 20 full-time employees, Medicare is primary for your claims, and the group health insurance is secondary. So if you do not pick up Medicare in that scenario, and you have a claim that goes through the system, that insurance carrier legally can come back and say, we are only paying 20% of this claim because that is all we are financially responsible for, and Medicare is responsible for the other 80%. And if you did not have Medicare, that becomes your financial responsibility. So as a reminder, when you're talking group insurance, it depends on this group size that you or your spouse is employed with.
Hey, Kevin,
Yep.
one other question. Everyone's situation is unique and different. So, you're a resource for those just to run, hey, Kevin, here's my scenario. Am I eligible or not? What does that look like? Is that just a phone call to you, or how do you go through that process?
Yeah, absolutely. Thank you. So I am a local resource. I will always be willing to answer your questions. So you can always call me. You can work through Nico in their office, and they will provide you my contact information. You can email me, you can text me. So if it's just a quick conversation, or if we have to schedule an appointment, I have two offices. I have one in Livonia, and I also have one on the east side in Clinton Township. And so I'm willing to meet you where it's necessary, or just to take a quick phone call and answer your questions.
And as a follow-up, the presentation recording will need to be approved by compliance prior to the YouTube channel, but we will do a follow-up email tomorrow to everyone on this webinar and that registered with Kevin's contact info. Thanks.
Perfect. Thank you. Yep. So one of the things you have to understand is that for those of you that work for a large group employer, when you leave that job, whether it's you get terminated, whether it's you resign, or maybe you are a spouse of an employee that maybe passes away, legally you are going to be offered what's called COBRA, all right, which will be a continuation of the health insurance that you have today for a period of time. Typically, it's somewhere between 18 to 36 months. What you need to know when it comes to Medicare and COBRA is that they do not play nicely together. Medicare does not consider COBRA as creditable health insurance. It's so strange to me that this is a guideline, because COBRA is literally the exact same benefits that you had when you were actively employed or your spouse was employed. But why it's important to understand why Medicare does not consider COBRA as credible insurance is because when you retire or you leave the company or your spouse does, if you don't pick up Medicare within 8 months of losing that active group health insurance, your next opportunity to pick up Medicare is going to be during the general election period. And those that pick it up in the general election period, as a reminder, face a late enrollment penalty. So whenever you are offered COBRA, you need to raise the red flag, take a step back and say, what am I going to do here? Do I take this or do I not? There are 2 scenarios where I tell my clients to consider COBRA. One is, let's say you were suddenly let go as an at-will employee and you had a pre-scheduled surgery 2 weeks down the road, and you have already satisfied your out-of-pocket maximum on your group health insurance plan, and that surgery was going to be covered at 100%, it may make sense to take COBRA for 1 month to not have to pay for that procedure or surgery, okay? The other scenario where I tell my clients to consider COBRA is, as we discussed earlier in this presentation, Medicare doesn't cover everything. Medicare does not cover dental. They do not cover vision. When you get offered COBRA, it is a la carte. You are going to see the chart and it's going to say, do you want to continue your medical? Do you want to continue your dental? Do you want to continue your vision? Or do you want to continue all of them all together? You get to pick and choose the benefits you want to continue. And so sometimes it makes sense to continue just the dental and vision for an additional 18 or 36 months to continue those benefits that Medicare doesn't cover. Medicare and HSAs are another tricky area. If there's anyone here on this webinar that is through an employer, has employer-sponsored health insurance, you are in a high deductible health plan and you are actively contributing into an HSA, you have to understand that if you want to continue to put money into that health savings account past the age 65, you cannot pick up any part of Medicare. So the question we got earlier from Nico was, do I need to pick up Medicare when I first turn 65, even though I have group health insurance? And I answer that question. It depends on the group size. But I always tell my clients that it sometimes, or most of the times, makes sense to pick up Medicare Part A, even though you have group health insurance. Why? It doesn't cost you anything to enroll into Medicare Part A. And two, you are getting yourself into the Social Security and Medicare system. They're issuing you a red, white, and blue card and a Medicare number. So when you go to turn on Part B later, you're already in the system and it's a little bit quicker of a process, okay? However, here is where I tell my clients, you do not want to pick up any part of Medicare. If you are on a high deductible health plan and you want to continue to put money into a health savings account, don't pick up any part of Medicare. If you do, you need to stop contributing, okay? If you are in a situation where you are over the age of 65 and you've already put money into an HSA and you're telling yourself, oh no, what did I do here? My advice to you is to reach out to your HR department, shut off the contributions, and then what you will have to do is you will have to work with your HSA vendor to find a way to pay that money back. The IRS, okay, they will never catch if you put money into an HSA and you're on any part of Medicare. When they will find it is if they do an audit. And if they do an audit and they see that, they will want their money back from the tax savings. The second part of HSAs that you have to understand is that if you are going to work past the age of 65, you are going to continue to put money into a health savings account past the age of 65. You need to stop contributing into the HSA 6 months prior to applying for Medicare. Why? Is when you go to apply for Medicare at 69, 70, 72, you get to choose the effective date for your Medicare Part B. What you do not get to choose is the effective date for your Medicare Part A. Social Security will always turn your Part A on 6 months retro. So if you have been putting money into an HSA for 6 months and you've been enrolled into Medicare Part A and the IRS sees that, that is a big no-no. So all I say here in this situation is when you have an HSA capability and you are putting money into it, it is okay to continue to contribute money into there as long as you have no part of Medicare, but you need to plan accordingly so you shut it off in a timely fashion. So delaying Medicare into delaying enrollment into Medicare Part B is very, very common for people who work past the age of 65. We've talked about this a few times here in this session, but what I want you to understand is that if this is your reality, you have to understand that when you go to turn Medicare Part B on at a later date, it is a manual process and it takes time. You want to plan ahead. So what you have to understand is that when you go to apply for Medicare Part B at 69 or 70 or 72, it's not just going online and submitting an application. It is a manual process to where you have to have 2 forms completed and provided to the Social Security Administration. The first form that needs to be completed is what is called the L564. If you are a married couple and you're in this situation, each one of you has to have your own individual L564 form. This is a form that is completed by the employer that offered you those benefits that while you were working. They are doing an attestation and telling the federal government that you have had creditable health insurance since the time you turned 65. This form here is allowing you to get Part B at a later date without any late enrollment penalty. The second form that has to be completed is what's known as the 40B. This is the form that you fill out individually, whether it's an individual or it's a husband and wife, you have your own forms, and you are telling Social Security that now I want my Part B to start and I want it turned on this date. If you go to apply for Part B after the age of 65 and you do not submit these forms, your application is going to get stuck and sit in the system until someone from Social Security calls you and says, what are you trying to do? You do not qualify to apply for Part B at this point. So it's very important that you plan ahead. You have these forms in hand and you're submitting them in a timely fashion to get Part B turned on at a later date without a late enrollment penalty. Here at my office, we will help you do this. We'll give you the timeline. We'll provide you the forms and we'll tell you what you need to do here. So how do you apply for Medicare? To apply for Medicare, there's 3 ways in which you can do it. The easiest way to do this is going on to ssa.gov through your Social Security account and submitting an application there. If you are just applying for Medicare through this window, it should take you maybe 5 or 10 minutes. So think of this as the portal where you go back, and maybe Nico's office does this, where they tell you if you retire or collect your Social Security benefit at 70 or 72, here's how much it's going to be. That is where you will apply for Medicare, through that Social Security portal. If you are not tech savvy and you don't want to do it online, you can do a walk-in if the Social Security office in your community is allowing walk-ins, or you can call. If you call to do your application over the phone, most likely they are going to tell you, we are going to schedule you an appointment to have someone call you back in 2 to 3 months to complete that enrollment. So you need to plan ahead to apply for Medicare. All right. So we have about 15 minutes left. And what I want to go over here is what we just discussed is traditional Medicare or original Medicare. That is what is the red, white, and blue card that you will receive in the mail from the federal government. You see that there is financial exposure, whether it's a hospital deductible or outpatient expenses with a 20% coinsurance. They don't cover everything like prescriptions or dental or vision. So this is where my clients tell me, what else can I get? What are my other options if I want to minimize that cost or I want to add on additional benefits? For those of you that are aging or nearing 65 years old, you are or you will get bombarded by phone calls, by text message, by emails, by mailings of everybody trying to sell you additional benefits. And that is what we are going to talk about here in just these next few slides. It is very common for someone who is transitioning into Medicare to start asking around saying, what did you do when you turned 65? What do you have for your health insurance? And someone might tell you that it's the best thing that they've had ever and that you really should consider it. And it may be, but what works for somebody else may not work for you. For individuals that are on this webinar that are spouses, a husband and a wife, you have always been together on health insurance while you've been through the employer-sponsored health insurance. When you go into Medicare, you will never be together for health insurance. You are making your own individual choice on what direction you want to go. Can you choose the same plan? Yes, but do you have to? No. So what is the directions in which you can choose? There are 2 different paths that you can take. There's what's known as path 1 and path 2. Path 1 is what I like to call the Cadillac of Medicare insurance. Now, I don't say it's the Cadillac because it's better. I say it's the Cadillac because it's going to be more expensive than the other product. All right. What is path 1? That is keeping your traditional Medicare or original Medicare A and B that we just talked about and wrapping that with what's known as a Medigap or a Medicare supplement and a prescription drug plan. Path 2 is what's known as Medicare Advantage Part C, and I'm going to break these two programs down for you. What is Medigap or Medicare supplement? The easiest way for me to help you understand what this is that Medicare supplement or Medigap plans are standardized health insurance policies that are sold to you or offered to you by private insurance carriers such as Blue Cross or Humana or Aetna. The easiest way to understand it is it's like going into the store and buying a can of Campbell's tomato soup. Whether you buy it at Walmart or Kroger or Costco or Sam's Club, it's the same product. The difference you're going to see is what you pay at the counter and maybe the level of service you receive when you walk through the door. That's how these programs work. They are categorized by letters, A, B, C, D, F, G, and N. So a G is a G, no matter who you purchase it through. The difference is going to be what you pay to be enrolled into the program and the service you receive when you work through the insurance carrier. You may have relatives or friends who are on an F or a C supplement plan. Those two Medicare programs have been closed down and those people are grandfathered into them. So the richest, most robust Medicare supplement plan that you can purchase today is what's known as Plan G. What is Plan G? Your rate for Medicare Plan G is going to be based off your age, your gender, and your zip code. Females tend to be a little bit less expensive than males. So what does it cost for a 65-year-old female living in the Tri-County area to buy Plan G? On average, it's going to cost you maybe somewhere between $120 to $130 a month. If you buy a Plan G, what did you just purchase? You bought three things. The first thing that you purchased was protection for your hospital deductible. So when you go this direction and you have your red, white, and blue Medicare card that we just talked about, and you have this insurance, that $1,600 hospital deductible goes away and you pay nothing for any time you are admitted to the hospital. The second thing that you purchased is protection for the 20% coinsurance under Medicare Part B. So when you go and use your Part B Medicare, the only thing you are financially responsible for is the Part B deductible of $226. Once you've satisfied that, you will never get another bill in the mail. The third thing you get when you buy a supplement plan is coverage for international emergency and urgent care. Medicare does not work when you go outside of the country. When you have a supplemental plan, it is going to give you a very small limited benefit when you're traveling and you have an emergency situation. What you have to understand about Medicare supplement, why do people get attracted to this type of policy? There's typically three things that people really like about this. One, you can see it's the very little or low out-of-pocket expenses. You will literally only pay $226 a year in medical expenses. After that, you will not pay anything additional. Two, there is no network. So even though you might buy Blue Cross supplement or Humana or HAP, you are not using their network of doctors and hospitals. Any provider that accepts Medicare has to take the supplement plan. And then the third reason is that this is not managed care. So think of the plan that you have today in your wallet. It might say HMO, it may say PPO, and think of if you had to get an MRI or a surgery, an authorization has to get on file. Not here. When you go this direction, there are no prior authorizations that are required. What are the buts? What are the things that people don't like about this direction? If you go with Medicare supplement, these plans increase premium-wise as you age. So by the time you're 70, it's not going to be $120 a month. It may be more like $160, $170, or $180 a month. Two, the other thing that you have to understand is that these plans will not cover things that Medicare doesn't cover. So because Medicare doesn't cover prescriptions or dental or vision, you do not get those included with this type of program. If you want it, you're adding it on and you're increasing your overall monthly cost. The most important thing that I want you to understand when you look at this type of program is that when you are coming into Medicare for the very first time, you will get what's called a Medigap open enrollment period. It only happens once and it will never happen again. Why is this period so important for you to understand? Your Medigap open enrollment period is triggered by two things. You are at least the age 65 and your Part B is active. Once that happens, for some of you, it's going to happen at the same time. For people who are delaying Medicare, it's going to happen at a later date. That triggers the open enrollment period. When you're in this open enrollment period, you are allowed to apply for any Medigap plan sold in the state of Michigan or the state you reside in, and your rate is based off your age, your gender, and your zip code. If you try to apply for a Medigap plan outside of this window, it is like applying for life insurance. The insurance carrier wants your prescriptions, your medical history, your height, your weight, whether or not you smoke, and they come back with 3 different decisions. 1, you're in great health, we'll take you at the preferred rate. 2, you're a little bit more of a risk to us, we're still going to take you, but we're going to rate you up. Or 3, they have the right to decline you altogether. So if you do not pick up this type of policy when you are first coming into Medicare, you may not be able to get it later on down the road. All right, we're going to move into Medicare Part D, and Nico, let me know if I'm cutting into the time here. So a few things here.
We're good. Thank you, Kevin.
We're good. Okay, thank you. Sorry. It's just very important information. I want all of you to know this as you transition into this phase of your healthcare. Part D is the most costly part of Medicare that I've seen with my clients. It is the most confusing and the most complex. Medicare Part D is what's known as prescription drug coverage. In order to have Medicare Part D, you must be enrolled into Medicare Part A, okay? Prescription drug plans must meet or exceed the guidelines that are set by the federal government, and these programs are sold to you by private insurance companies such as Humana, Aetna, Blue Cross Blue Shield, all right? What you have to understand is the plans that you are going to be eligible for prescription drugs is strictly based off of your zip code and where you live. If you want drug coverage when you are first turning 65, you have the ability to pick it up during the initial enrollment period. That's that 3 months before your 65th birthday, the month of, and 3 months after. If you don't pick it up during that window, your next opportunity is during the annual election period. You will never miss this window. This is when all the commercials start, the mailings start to come, the billboards are running, the radio ads are coming on. It's October 15th through December 7th. Anybody on Medicare is allowed to pick up drug coverage at this time or make changes to their existing drug plan. And then you have special enrollment periods. So for those of you that might be working past the age of 65 and you might retire at 70 and you want drug coverage when you retire, you're going to get a short window to qualify to pick up drug coverage in the middle of the year. What you have to understand is that there is cost to prescriptions, and for some of you, it may be very, very expensive. There is a premium you will pay to be enrolled into Part D, and it varies. The lowest premium here in the state of Michigan for drug coverage is about $3 and maybe 40 cents a month. And on the high end this year, it's about $190 a month. So it varies. The second thing you will pay is cost share. So when you walk up to the counter at the pharmacy, you may have a copay or a coinsurance for your prescription. What I want to emphasize here, and I know that RWS works with a lot of the municipalities and the teachers through the state of Michigan, some unions, is that if you are offered retiree health care through the state of Michigan, maybe because you're a public school teacher or through General Motors or Chrysler or Ford, please ignore these slides. If you are not offered retiree health care, this is a reality for you here over these next few slides. Medicare or Social Security, however you want to look at it, breaks down drug coverage into 4 different phases. And all of these insurance companies have to abide by these rules. The government says to them is that if you want to put a drug deductible on the prescription drugs, you are allowed to do so. But for this year, it cannot exceed $505. So when you start to shop drug plans, and this is what we do for our clients, is we get your prescriptions, we navigate it, we help you get through the system and show you what plans work. But if you go to look at it on your own, you're going to start to see that there are carriers that have a drug deductible of $505, some are $200, some are $100, some don't have a drug deductible. But what you need to know is that you will not see a drug deductible greater than $505 for this year because it is not allowed. Once you get past that phase, you are going into what's called the initial coverage election period. This is where it's very similar to what you are paying right now when you go to the counter to fill your prescriptions today. So if you're filling your atorvastatin or your Synthroid and you're paying $4, that's what happens here. Whatever the copay is what you will pay. You will continue to pay those copays until what you have spent and the insurance company reaches $4,660. If there is anybody on this webinar that is taking a prescription that is advertised on television, like Trulicity, Trujeo, Humira, those prescriptions are extremely expensive. And for you to reach that $4,660 threshold is a reality, and it may happen early in the year or in the middle of the year. And when you reach that threshold, you fall into what's called the donut hole. And when you fall into the donut hole, you start to pay 25% of the cost of that prescription. So if the Entresto or the Xarelto is $900 a month, you are paying 25% of $900. So this is where I sit across from my clients, and it can be a very, very hard conversation. And there are times where I say, when you go to fill your prescriptions in July, the pharmacist is going to ask for $400 because you have fallen into the donut hole. But I break it down for you so you're not surprised and you're not shocked when you go in and they try to charge you a higher amount. And I also help my clients get access to pharmaceutical assistance programs in ways to cover cost for high prescriptions. The last phase of Part D is what's known as catastrophic. So this calendar year is that if you ever reached a total spent of $7,400, you fall into catastrophic and you pay very, very little for your prescriptions for the remainder of the year. Phase 4 is going away in 2024. That's no longer going to be part of Medicare. So as I tell you that this program or Medicare changes every single year, here's an example. This is the part of the Medicare program that's going away due to the Inflation Reduction Act. All right, so what you need to know too, and then we're going to move to Medicare Advantage and we're almost done, is that Medicare prescription drug plans are not all equal. One carrier might cover Novolog, the other one might not cover Novolog. They're all over the board, and it becomes your responsibility to find the plan that's covering your prescription drug needs the way that you need it covered. We, as a resource, will help you navigate those programs. For those of you that are not on any prescriptions and you say, you know what, I'm not dealing with that racket. When I need prescription drug coverage, I'll pick up Part D at a later date. If you do not pick up drug coverage when you are first eligible at 65 and you do not have other credible prescription drug coverage in place, when you go to pick it up at a later date, you will be able to get it, but yet again, you will be penalized and you will face a monthly penalty lifetime. How does Medicare assess the penalty? For every month that you go without drug coverage when you should have had it and did not have other drug coverage in place, there is a 10% penalty of the national average of the drug card that's being accumulated behind the scenes. If you never pick up drug coverage in your life, you'll never see the penalty. But if you pick it up 3-4 years down the line, you will see that penalty that is assessed to you. So every month it's about 34 cents that's being penalized or being assessed to you. So for this example here is someone who went 12 months without drug coverage. That $3.45 drug plan is not going to be $3.45 for them. It's going to be $3.45 plus the $4.08 every single month. And what you need to understand too is that not only is there a higher amount you may pay for Medicare Part B to being a higher income earner, you could also pay higher amounts for Part D as well. All right, we're at the very end of the presentation, and this is what's known as Medicare Advantage Part C. We have about 5 minutes left, and then I can open it up for questions if anybody has questions, and I'll turn it back over to Nico. This is the second path of Medicare. Okay, what is Medicare Advantage? The easiest way for me to explain this to you is that it's very similar to what you have in your wallet today. Think of how you use your health insurance. When you go to the doctor, the hospital, the pharmacy, the dentist, the vision provider, you only pull out your Blue Cross card or your Priority Health card. That is how this program works. It takes all of the parts of Medicare that we just talked about and bundles it into one insurance card. When you choose Medicare Advantage, you are enrolling with a private insurance carrier such as a Blue Cross or a Humana. These insurance companies are required to cover everything that is covered under Medicare A and B, but the federal government allows these insurance carriers to cover things above and beyond what you get with traditional Medicare. When you shop Medicare Advantage plans, your eligibility is strictly based on where you live, your zip code, your gender, your health, your prescriptions, your height, your weight never matters. So a 65-year-old female living in Farmington Hills that is perfectly healthy is paying the exact same rate as a 90-year-old female living in Farmington Hills with chronic conditions. Your rate and eligibility is strictly based off where you live. In order to have a Medicare Advantage plan, your rate is based off, or I'm sorry, you must have Medicare A and B, and you have to continue to pay the Part B premium. So to take that off the table, what you need to know is no matter what direction you go, A or B, you must always pay the Part B premium. Now, I have several clients that I work with. If they choose Medicare Advantage, 100% of my clients choose a Medicare Advantage plan that does not have a premium. So outside of that Part B premium of $164.90, they are not paying anything additional to have this type of policy, okay? When you have this plan, I mentioned to you it covers your Part A, it covers your Part B, it covers your Part D prescription, you're getting dental, you're getting vision, you're getting a gym membership, you're getting hearing aids, you're getting vision, you're getting dental. How are you getting all of these things included at no cost? What you have to understand is that if you choose this direction, this is the path where you save your money and you pay as you go. When you are on Medicare Part C, or what's known as Medicare Advantage, you will have copays. When you're on path 1, which is the Plan G, the Medicare supplement, you don't have copays. So that is the difference. Pay up front to not have to pay when you go in and use it, or save your money and pay as you go. All right. A couple other things that you have to understand about Medicare Advantage Part C is if you go this direction, whatever insurance company you choose, you are agreeing to use their network of doctors and hospitals. So if you choose Blue Cross Blue Shield of Michigan, you want to make sure the providers that you are seeing accept the plan that you're enrolling to. These programs are managed care. So you're going to have the option to choose between a PPO or an HMO. And if Blue Cross requires a prior authorization before you get your knee replacement, your doctor has to get the authorization on file. So this is very similar to what you have today, okay, at no cost, but you will be paying copays as you use your health insurance. All right. If you want Medicare Advantage, when you first turn 65, you have 3 months before the month of your 65th birthday, the month of, and 3 months after. Once that period's gone, it's gone. If you did not pick it up during that window, you have during the annual election period or special election periods. When you choose a Medicare Advantage plan, do not think of it as your lifetime decision, saying, okay, if I choose Blue Cross, that's who I'm going to have for the rest of my life. No, you get to make a change to your Medicare Advantage plan every year with no questions asked. So I want to just end on a couple things here, and then I'm going to turn it back over to Nico. So you see that Medicare can be very, very confusing. There are a lot of things that you need to consider as you make your decision about the future of your healthcare, but I want to break down just a couple of things between the two different paths. Why do people get attracted to path one? As a recap, there is no network. So if you choose a Medicare supplement plan through Blue Cross or Humana or Aetna, you are not using their network of doctors and hospitals. If you choose a Medicare Advantage plan, path two, through one of those carriers, you are using their network of doctors and hospitals. The other thing is that under path one, you do not have copays. Under path two, you will have copays. Under path one, you will pay a monthly premium, and it increases every year to be enrolled into that type of coverage. Under path two, you do not pay a monthly premium. And then the other thing you have to understand is that one is managed care, right? So Medicare Advantage, you may have to get authorizations, where the other one, you do not have to get authorizations. So I am a local resource, and I appreciate RWS for inviting me in to be able to provide this information to you. But if you have any questions or you feel that you can use my services, I am available and I'd be more than willing to assist you. But I do want to thank you all for attending, and I want to thank Nico for inviting me to provide this information to you.
Thank you, Kevin, and we sincerely appreciate your knowledge and your expertise here. So I'm going to go to the next page. A few closing remarks. We do have a few questions, but for those that do need to leave, we host these webinars. We are thankful you're attending them. It means so much to us. One of our core values to provide education, something we're passionate about. Our webinars are the last Thursday of every month at 7 p.m. Eastern. In August, we have Optimizing Your Social Security. September 28th, we have a keynote economist frequently seen on CNBC nearly weekly. Dr. Chuck Lieberman will be on providing a market update. October, leading up to holiday season, we'll have identity theft. So the bottom left here is our phone number. Text us any additional questions. If you need to leave now, thank you for attending. And we sincerely appreciate you being part of the RWS family. Kevin, two questions. One, for the moment. One is, what about traveling out of the country? Say you're going out for part of the year, or you are you have a 2-week vacation to Canada.
Very good question. So I'm going to answer that in two ways. Medicare, the red, white, and blue card, A and B, will not work if you are international and you have an emergency. If you choose path one, Medicare supplement, plan G, you will get a very limited foreign travel, emergency and urgent care benefit. And what do I mean by that? You will have a $250 deductible. Once you satisfy that supplement plan will come in and cover you at 80%. You pay 20% for the emergency situation, and they cover you at $50,000 lifetime maximum, okay? If you're on path two, Medicare Advantage, you are covered for emergency and urgent care coverage outside of the United States, and you pay the in-network cost share. But I will tell you how it historically works is that you are going to pay up front, and you are going to be seeking reimbursement when you come back to the United States once you provide the claim in English. What I tell my clients is that if you are traveling internationally, it sometimes makes sense to buy a traveler's insurance policy. Give you an example, for a week stay in Ireland for 2 people with a no deductible $1 million maximum policy, it might cost you about $48 for the week. So and it's true traveler's health insurance. So answering that very quickly, it's a very, very limited benefit.
Okay, thank you. And is that something you or Medicare agents generally do provide also? Is that traveler's insurance?
Yes.
Okay. Another question came in for Medicare Advantage Part C. What are examples of copays? What would be some quick examples?
Very good question. I usually give 2 examples in this. I give you the worst case scenario, and then I give you the one that's one that's more of like a reality. The
Okay,
highest copay for a Medicare Advantage plan is going to be the inpatient hospital admission, right? That's the most expensive medical procedure. When you're on a Medicare Advantage plan and you get admitted to the hospital, what these insurance carriers do is they break it down to a flat dollar copay per day for a certain period of days. Typically, it's days 1 through 6 or 1 through 7. And what that copay looks like is anywhere between $300 and let's say $10 to maybe $350 per day. So if you were in the hospital for 2 days, no matter what was done in that admission, and it was a $20,000 bill, you're going to be looking at paying somewhere between $600 to $700 for that stay. The second scenario I like to give folks is, let's say, outpatient surgery, right? Nowadays, these providers are doing knee replacements outpatient because medicine's so advanced. If you have a knee surgery done outpatient, what is that going to cost you? On Medicare Advantage, it's going to be somewhere between $125 to $350 for that surgery. What comes next though is physical therapy. You're gonna have a fat dollar copay for your physical therapy benefits. But my uncle is on a Medicare Advantage plan. He had a knee replacement, and I said, tell me what you paid for that surgery. He goes, I paid $125 to have my knee replaced.
wow,
Yep. So what you need to know is under Medicare Advantage, you will see when you start to look at these programs, it is flat dollar copays for your benefits. You will know and you will see what the cost is. So it's very predictable, very different than what you're probably on today.
do the majority of your clients tend to lean to one structure, path 1 versus path 2, or what would you say? Is there an average or standard?
I will tell you what my clients do, and then I will give you the industry standards. So, and I know this probably doesn't help, but when I sit down with my clients, because I give them all the information they need, it is a 50-50 split. When you look at the industry as a whole, or our country or nation, right now, about 7 out of 10 people coming into Medicare are choosing path 2 Medicare Advantage. I've been doing Medicare, or I've been in the Medicare space for over a decade. About 7 years ago, it was completely reversed. About 7 out of 10 people coming into Medicare were choosing Medicare supplement, but now it's shifted over to the entirely opposite direction.
Great. Well, we do not have any other questions, but there you have it, folks, from Medicare expert Kevin Cox. Thank you so much, Kevin. This has been really enjoyable, and we appreciate all your knowledge.
Absolutely. Thank you so much for having me.
Thanks, everyone, for attending. Take care.